comes to ageing, it's not how old you are, but how you are old that matters. So how do you keep living life your way when it makes sense to access services that can make a difference? Brought to you by Unitng AgeWell, the Aging Ideal aims to start conversations to cut through the noise and provide people with a greater understanding of this important chapter of life.
I think we'll actually affix people where they need to be, which is front and centre, and allow them to attain their human rights. It will mean that for industry, we're going to have to make those adjustments, right? So we have to have a laser-like focus on customer care, a laser-like focus on building those relationships and that rapport, a laser-like focus on understanding that what someone wants and needs, we have to be able to accommodate that.
That's Fonda Voukelatos, Deputy CEO of Unitng AgeWell. And it's fair to say the options for older people have improved, but there's still a way to go. In the Aging Ideal, we're looking at all aspects of ageing and hopefully debunking some of the myths that surround it. We've looked at mental health, the impact of being a carer, and sharing stories where people continue to live amazing lives at any age. A reality for many as they grow older is the need to start support services. Aged care services have come a long way, and the push is for people to have greater choice and easier access to services, to continue living independently at home if possible, and to have more say in what and how they receive those services. It's also about changing the narrative from needing support to choosing support to enhance lifestyle and continue to do the things we enjoy. Nearly 500,000 Australians access aged care services at present, and that will increase substantially in the coming years. Government reform started over 10 years ago to give older Australians more choice and control over how they live their lives. In 2025, the aged care industry will embark on significant generational change with a new Aged Care Act passing through Parliament in November last year. These changes will come into play in July this year. So why should people be interested in what the sector has to say about these changes, and why, in fact, should people be more aware of aged care services in general? I interviewed Unitng AgeWell CEO Andrew Kinnersly last year. This interview sets the scene for what has happened so far. We'll also get some first-hand insight into what it's actually like to navigate the aged care space from Fonda Voukelatos, Unitng AgeWell's Deputy Chief Executive, who himself faced significant challenges trying to get support for his ageing parents. But first, where do things stand with aged care in Australia?
There's no doubt it's been a really challenging 5 or 6 year period. The Royal Commission needed to happen. We had a number of things that needed to be talked about. We went through that process and obviously in the middle of it, the pandemic hit, and it was incredibly challenging.
Why did we need a Royal Commission?
A lot of reasons. If we go back to 2016, 2017, there were too many points of failure in the aged care system. We had too many providers, in my view, providing substandard care. We had a system that was underfunded. We didn't have enough staff, boots on the ground. In residential care, people didn't have enough access to the system in services. And fundamentally, I think most people would agree that the system was broken. And providers and the performance of providers, I think, was part of that. But as was found throughout the Royal Commission, there was a lot of parts of the system that needed to be overhauled and needed to be fixed.
There's certainly been a lot of scrutiny and criticism of the aged care sector due to the Royal Commission and the impact of the pandemic. How have organisations like Unitng AgeWell managed to retain trust and not be tarred with the same brush?
I feel that we've always maintained a fairly high level of trust, even through the Royal Commission and certainly through the pandemic. And I look at the way that we responded in the pandemic in particular, and the way that we communicated with the broader Unitng AgeWell family, whether that be our staff, whether that be our residents and clients or indeed their families. I think you can build trust with the way that you communicate. I think it's really important to be upfront and say when you get things wrong. And I think where you start to build trust, and where I think we've built trust, is by acknowledging where things needed to get better and do something about it. I think it's about the way that you provide your services, and it's about the love and respect and the kindness that you incorporate into everything that you do. That builds trust. It builds trust with our residents, with our clients, with our families, and I think with the broader community. When you're talking about things that you've done to provide better care, that's really important.
The Royal Commission also observed that aged care staff were underpaid, and you've also echoed the finding that the sector was under-resourced and under enormous pressure. How has staff pay been addressed since that Royal Commission?
It's a really interesting question, and there has been a wide-reaching response, particularly by the federal government and through the Fair Work Commission, and we've seen pay increases in their minimum award for a big percentage of our nurses, and that certainly made a difference in retaining staff. It's made a difference in terms of attracting staff. Probably the other significant thing that has changed is that we now have minimum staffing requirements. In residential care, we've got 24/7 requirements for nursing staff. We've got minimum minutes of care per resident per day that we have to abide by, and all providers are doing what they can to meet those mandatory requirements, noting that we've got still a workforce shortage that every provider is battling with. But higher wages and higher numbers of staff on the ground, I think, will assist significantly with regards to staff burnout. It means our staff can take their annual leave, and I think moving forward it'll be a far happier place.
You said it will make for a far happier place, but how do you see that impact extending to the customers and residents that you serve? In what way does all this good stuff flow onto them?
Yeah, we've probably seen a fairly significant difference over the last couple of years, and what I'm seeing is families feeling more reassured. Certainly our staff from our admissions team, our local managers, our local staff, when they talk to residents or clients in our home care services, it's a really important discussion up front. I've been through that myself in recent times, and the reassurance that can be provided, the explanation that's required, because it is a complicated system, those things become really, really important. And what we're seeing is improvement with regards to what was a fairly significant trust deficit. I see that changing quite significantly, and I'm seeing families looking more reassured, and I'm seeing families that are in a much happier place once they tap into the services that we provide.
How do we balance then that financial sustainability with continuing to deliver the best possible care for your customers or residents? And I mean, it sounds like it might present a disadvantage to some people.
So if I look back over the last 3 or 4 years, there is no doubt that a number of aged care providers have been in a position of financial deficit. They're spending more than what their revenue profile is. To be able to continue to provide good quality care, they've had to run at deficit levels. And we would be an example of exactly that, where we've been in a situation where we've been in operating deficit, but we've still done everything we can to provide good quality care. That's got a lifespan, because you can't continue to run at an operating deficit before you run out of cash, before you effectively go broke. So the changes that are coming in are going to be critically important for that.
Part of the challenge for aged care providers is remaining sustainable under a model that hasn't really allowed them to be financially buoyant and reinvest in things like innovation. If the reforms yield better financial outcomes for providers, what do you think will change?
I've always thought, and many people have thought, that older Australians deserve a 5-star aged care system. Providers can't provide that with a 2 to 3 star level of funding, and that's something that's I think has been well addressed in terms of the development of the new Aged Care Act, and it's had a number of recommendations from the Aged Care Task Force built into that to make the system sustainable as we move forward. I look at what additional resourcing means, and I think about the extra staff that we can employ. I think about the staff retention, given that aged care workforce are now paid at a more appropriate level. I think about the improvement in capital facilities in our infrastructure, which is really important. And I think about the increase in service levels, which directly impacts on waiting times of which people can tap into service. An example of that would be the waiting time to be assessed for an aged care package and the time that people wait to have a package allocated, and sometimes that can take up to 2 years.
Fonda Voukelatos has worked in the aged care sector for over 20 years. As the Deputy CEO of Unitng AgeWell, he's well across the good, the bad and the unspoken when it comes to aged care.
So when I joined Unitng AgeWell 10 years ago, one of the key activities was to introduce the notion of consumer-directed care, specifically into the home care package area. It shouldn't be something that is program-led. It's something that the organisation needs to embrace, embed, and make sure that the systems and the supports are there to enable our staff and our clients to exercise their rights around consumer-directed care. So one of the earliest activities for me was taking evidence-based research I'd undertaken with a range of universities, including Deakin University and a range of stakeholders, and introducing that across all home care operations.
What kind of research was this?
It was called Person at Centre Stage. It was in response to the dearth of research which looked at the customer experience and consumer-directed care in Australia. So we knew that there were things that were happening anecdotally. Any models that we had seen from the disability space or social role valorisation, had they been road tested in the older person space? Clearly not. So it was pretty novel research that we undertook. And that was a big step forward, for a not-for-profit to undertake that and our peer organisations. But what it did mean is that what we thought that we were doing really well as a provider and as organisations nationally were very different from the needs, wants and expectations and goals of individuals. Who would have funked it, right? And ultimately what that led to was, the creation of what we have now within the industry, co-designed care plans, co-designing budgets, transparency, informed decision-making, a focus on reablement or restorative care, which is supporting people with their allied health or physical care needs to be as independent as they can. It was about choice, flexibility and control. That's the language that people used. And, that's what we've tried to embed within our organisation. Move away from using some of the more traditional language to using terms like people don't want to be cared for, but they need assistance. Fundamental shift in the language. So significant transformation required. It wasn't really just around, paperwork or putting in a new compliance mechanism and all that, but it was overlaid with that whole notion around person-centred, person-directed care. There was a layer of community development and resilience development for our participants so they can actually recoil as well. So appreciating their background and histories, what they had to bring to the table from a social capital perspective, how do we leverage that and bring that forward?
What will happen when I'm older? It's a question people tend to avoid in their early years, including the children of ageing parents, even though it's ultimately these children who'll be assisting their parents as their needs increase. They've been called the sandwich generation, those people caring for kids and parents at the same time. So how can we engender cross-generational interest in aged care and drive home the importance of truly understanding the system and options for older people? Fonda explains that despite his knowledge of aged care, when it came to his own parents, the challenges were very real.
My folks are both in their mid-80s. My poor mum passed away. Both of them were born overseas in Greece and had migrated here. Essentially, what was required for them to engage with professionals in the hospital was a translator. And it's well understood that if you need a translator, it's pretty much one's provided for you. But in their situation, and I had to think about other people, that wasn't offered. So they pretty much had to deal with hospital professionals on their own. So you can imagine health literacy being an issue, literacy full stop being an issue, and then being intimidated in a clinical setting in dealing with professionals who are talking to you in English and probably using technical jargon as well. But in the lead up to that, they needed basically home and community services initially. So, for people who are fiercely independent, fiercely private, fiercely autonomous, have had really good social networks, really good links to their local community, as they became unwell during their life journey, a lot of those things dropped away. And for my parents, when it was time where they did need support and care, I moved away from being a provider to actually being a consumer. And that to me was a pretty torrid experience. Very torrid for my parents and very, very torrid for me, but also frustrating, can I say. So some specific examples were one, getting my mum registered with my aged care. That seemed relatively straightforward, but it was done basically over the phone.
So, Fonda, once you were registered, what happened next?
I was interpreting, but then the waiting game begins. So, the rationing of services meant that they needed to have a regional assessment team come out and do an assessment. Then you had to wait for the service delivery side, and then if you needed a home care package or residential aged care, you had to wait even longer. Now, that whole process for my mum took 9 months. And it really is unacceptable that we feel it's okay for people to wait when normally it's an acute event or something like that leads them into needing services and care. Like I said, a lot of people are very proud. They don't want to ask for anything, especially the generation that my folks are from. There are all these little obstacles. I know on a number of occasions where my dad had to take my mum to hospital, for scheduled appointments, hospital wouldn't organise translators. And they wouldn't tell me, as the primary contact, which was on their file, that the appointment was happening. So then we go back and then we revisit the situation. And then during the pandemic, which I think was crushing for many, many older Australians, who became more and more socially isolated, more disconnected from the health system, etc., it became even more challenging at that point. So the number of staff I'd spoken to in hospitals would be like, we see this all the time, people become really frail, they regress in their conditions. But it was quite a tumultuous time.
I can't help thinking, if it's this hard for someone who works in the industry to navigate the system, how can we expect the average person to successfully work their way through it? And at a stage where time is of the essence, the frustration and pressure on all parties is needless but very real.
Yeah, and I've worked in the sector for a better part of 20 years. I've got a very senior position, but the real equaliser, and we should never forget this, is that when you need care or healthcare or whatever it is, it doesn't matter who you are or what you are. Every older Australian needs to have access to care management, which is basically a form of advocacy and support, care navigation, which is around navigating through not just the aged care system, but the aged care health system. We know from maybe a starter, the Australian Bureau of Statistics, that people with severe profound disabilities, and that's any age, one of their top 3 challenges each and every census is healthcare coordination, health literacy, financial literacy. So let's move away from our segments, silos, etc., fragmented system. And if you'll fix the person and their journey, then those services need to come around that individual. And you need to take a very different view from what we take today on it.
So how do we make things better?
The Royal Commission pushed out over 140 recommendations. There are some really good gems within that. One of them is a renewal of the Aged Care Act. It's no longer going to be an organ of administration, but it's going to have a set of principles which enshrine the rights of every Australian to good quality and safe care. And this is seismic, I suppose, for our industry. It's no different from what we had seen with the NDIS. The legislation that came through there was all principles-based. It was person-centred care, person-directed care. It was about the person's outcomes versus the administration of programs. And meeting people where they are, appreciating that people don't often know what they want or what they need. And it's difficult to actually do something to people if you haven't built that trust and rapport, right? We know that through all our relationships day in, day out. So fundamentally, those types of recommendations which have been taken up by government, I think will actually affix people where they need to be, which is front and centre, and allow them to attain their human rights. It will mean that for industry, we're going to have to make those adjustments, right? So we have to have a laser-like focus on customer care, a laser-like focus on building those relationships and that rapport, a laser-like focus on understanding that what someone wants and needs, we have to be able to accommodate that.
We've heard some optimism in these conversations. Do you share that optimism in the sector broadly?
Absolutely. So, as we know, the aged care sector has been through a fair bit the last few years. It's front and centre with a Royal Commission, a commission that did need to happen, but also through the pandemic. And if there's one thing that I have seen during that period, and it continues to amaze me each and every day I interact with our staff, is the commitment to do well, the commitment and the laser-like focus on the client and their welfare, the commitment to see better days ahead. So as a collective, people have been galvanised with that common focus. And I think for me, it's that movement in. If you've got the right people with the right values, and their values are intertwined with those of the organisation, and Unitng AgeWell has some really strong, pertinent, relatable values, then that gives me a lot of hope. And I see that within the industry with our peers as well. So, when I talk to my network of colleagues, everyone's driving towards the same outcomes. And penultimately, the outcome is supporting people to attain their human rights. The whole concept of beneficence and what that means and what that confers. And we must move away from commoditising aged care. Government need to tip in. We all need to tip in and co-contribute. But ultimately, we need as an industry to be value-based, and we need to be accountable, and we need to be transparent.
How is your father, and what have you learnt supporting your parents?
Yeah, so my dad's still with us, and he's relatively independent. He has a home care package, but typical dad, he is quite a stoic person. He goes, I'll just leave it until I need it. So he still does his own gardening. He still manages household chores. He does his own shopping. But I know when he has lent into that system, in particular, in his caring role with my mum, it's challenged him a fair bit. I think what's challenged him, and probably what's challenged me as well, is it's been overlaid with prejudices around aged care. It's been punctuated with people's judgments and opinions about what you should be doing when you get to a certain age or a certain degree of frailty. But at no point do people say to my dad, or to me for that matter, and what are your thoughts around that? How can we make this life an important life, one that's valued regardless of the age, and how can we support you? So are we part of a machine and part of a problem, or can we flip it and advocate? Because at which point do we find this acceptable as a civil society?
It's important to understand that not all of us will need aged care services, but a large proportion will, even if their preference is to remain at home. So it's imperative that we provide top-notch aged care for those who need it and enable more people to spend their last years at home if possible.
So, there's really good statistics. Over 50% of people over the age of 85 need aged care services. It's graded back a little bit. Importantly, when you talk to people, and I talk to a lot of people, friends, family, younger people, we have this notion that we want to have a good life and a good death. And a good death for me is really something that is probably a little bit taboo. We don't really talk about it. But fundamentally what that means is that even though it may be an older person's wish to pass away at home, in fact only 15% of people do that. Predominantly they pass away in hospital or in residential aged care. So there's something that needs to be flipped around that as well. There's got to be a fundamental shift. There's got to be fundamental investments around innovation and the coordination between palliative care specialist services for home and hospital systems to really support people to meet their goals and aspirations. And, so when I talk about human rights, that's what I mean. It should be my right to pass away at home. I may not need government funding for it, but give me my options. That's what I found with my mum and dad is it's one thing to wait, but we couldn't wait. It was a pretty urgent situation. So having the means and all that, I funded private services. But even those conversations aren't happening, with assessment groups or whatever. It's like, well, you're going to have to wait for a period. Well, that's fine, but what am I going to do in the interim? Because if I'm waiting, doesn't matter if I'm waiting and I'm a young person or an older person, it's my time. And I want to be productive. And I want to engage. And I want to feel valued. So it goes quite deep in terms of where we are now and where we need to get to, basically.
A lot of what we've talked about today is about information and knowing how to navigate a system that is still finding its way. Yet, understandably, people often don't try and understand what is available to them or their loved ones until there is a crisis or they're needing more support. I asked Andrew Kinnersly his thoughts on how to engage people to learn more so they're prepared and understand what is to come.
My observation would be most people wait too long. I think there's a community education piece that's required from government and from providers to really encourage people within the community to start asking questions a lot earlier, start planning a lot earlier, talk to financial planners a lot earlier, understand what the impacts might be in terms of your aged care requirements or indeed your family's aged care requirements. And you look at that and you think, well, okay, they're hard conversations sometimes to have, but I see all too often, and I've seen the same in my own family, where the conversations are avoided and the planning doesn't happen, and then we're in crisis mode, and then we're trying to tap into the system, which is, to be honest, is too late, because particularly when you've got a waiting time for services to be allocated to you. So my advice to people within the community is have those conversations sooner rather than later and just plan for the future.
We really are on the brink of another transformation in aged care come the 1st of July, Andrew. What will be some of the benefits of these changes?
There's a whole range of benefits that we'll see. I think we'll see a lot of growth in services. What that will mean is a reduction in waiting times for assessment and for allocation of packages and residential care beds. I think we'll see a lot more accountability at provider level in terms of what we need to do as providers. If providers get it wrong, I think there'll be more penalties built into the new Aged Care Act, and I think that's really important. I think there'll be a lot more transparency. The way that we have to publish data, what we're doing well, what we're not doing well, an ability for consumers of services to be able to compare providers. I think that'll be stronger as we move forward. And I think there'll be far greater access to services. It'll take time to see some of those benefits come through. But one example I would look at the moment is sometimes there's, as I may have said earlier, there's a 2-year time gap between when somebody first accesses the system to when they might have a home care package allocated. And that's just too long. What we're seeing is families and clients entering the system when they're close to crisis point, and to have to wait another 2 years to have a home care package allocated is just not good enough.
There is no question aged care in Australia is on the right track, and the aspirations to a rights-based system are in sight. But what is it Andrew feels hopeful and optimistic about?
It's the people. If I'm ever feeling less than optimistic, all I need to do is go and spend some time out at one of our nursing homes or one of our home care services or one of our retirement villages, or spend time at a staff celebration event. And I see that professionalism, I see the hope, I see the difference that we make. I see a system that is getting better. I'm hopeful because I believe both sides of government want a 5-star aged care system, and both sides of government acknowledge that we're not there and that we need far greater support to get to that point. And whilst we're not there yet, I do believe we'll get there. I do believe we'll have a more sustainable system. I do believe we'll get on top of our workforce challenges and we'll be in a really good space as we move forward. There's so many stories of good things that happen, and we heard a lot of the bad things through the Royal Commission and through the pandemic, and as I say, some of those stories were fair, some of them unfair, But there's so much good that happens right across the sector, right across Australia. We need to celebrate the good things. We need to celebrate the good case studies and really promote those, because there is a lot of innovative things that are happening. Our staff are fabulous. We want it to be a career of choice, and that's something that it hasn't been, and I'd really like to see that change as we move forward. And with all that, I feel really hopeful for the future.
You've been listening to The Ageing Ideal, a podcast for Unitng AgeWell, produced by Sound Cartel. Subscribe free wherever you listen to podcasts. For a list of really helpful services available to the community, you can head to the show notes of this episode.